HIV rates are now beginning to fall in Ireland. But more importantly, there is now a movement that is telling people living with HIV in Ireland that they do not only have to live with HIV, but they can thrive with HIV. That actually, HIV doesn't make you unlovable. It just makes it one extra thing that someone's gonna love about you, or you're gonna love about yourself. Thanks to community, the epidemic of silence is no more in Ireland. There is momentum. The feeling of change is palpable in Irish society. Now, if I can take a leaf out of Lord Fowler's book here, I have a movie coming out on Netflix, okay? This World AIDS Day in Ireland and the UK, it's called How to Tell a Secret, and it's all about HIV disclosure. How do I tell my mum? My mum's in it, she's great, you'd love her. How do we tell our children? How do we tell our partners that we live with HIV? Or why don't we tell them? For many people around the world, this is one of the biggest questions that we have to ask ourselves. It's so complex and it's such an individual thing to navigate. So we watch, give it a thumbs up. We want to beat the algorithm. We want to make sure that Netflix brings it to a global audience. Yet, all these achievements take our time, our expertise, our energy. We need to be supported. We need to be resourced. And we need not just be merely given a seat at the table. We need to lead the table. I'm happy that they gave a table because this leads nicely into it. Speaking of leaders at a table, over the next 30 minutes, we have an amazing list of speakers lined up. You'll hear from leading figures in the AIDS response and community leaders who will give their voices on just how important communities are in tackling HIV. We will then hand over to members of the press for their questions. So, without further ado, to kick off the discussions, I'd like to hand over to one of the world's leading voices on HIV, inequalities, and human rights, the Executive Director of UNAIDS and the Under Secretary General of the United Nations, Winnie Benema.
Thank you, Robbie. You're so inspiring. Is this thing working? Yes. Okay. You're inspiring. Thank you all for coming, especially the press who are going to put our word out there. Thank you so much. Thank you, Stop AIDS, for hosting this media launch of that new report. Can I have a copy? Show it off. Yes. Thank you for being here. As we launch this report, we call it Let Communities Lead. And we're so delighted to be doing it here in London with our dear friends, our ambassador, Lord Fowler, and the institutions we love and admire, like the Sir Elton John AIDS Foundation, Terence Higgins Trust, Stop AIDS, of course, Frontline AIDS, and many others. You inspire us, you lift us up. Every time we come here, we are on a buzz. Thank you for keeping HIV on the political agenda here in your country. So many things are devastating this world, the wars, everything going on. But you fight and you keep this issue on the political agenda because every life matters. So I do want to start by acknowledging that the world is rocked with so many crises, from wars to climate impacts to humanitarian crises and so on, and we see no solutions to some of them. The United Nations was created to bring peace in the world, but we are unable to resolve some of the major crises that are rocking our world today. But I want to say this on World AIDS Day, that though the world is bleak, there is one crisis where the countries of the world got it right. The governments and their people got it right. And that is this AIDS pandemic. That 25 years ago, all the governments of the world came together. Civil society came there. And there was an agreement to fight this to the end. And 25 years on, this global solidarity still exists. Every 5 years, the same countries come together, set new targets. Rich countries helping poorer countries, civil society holding hands globally to fight to the end. So this is a success story. This is a success story of global solidarity. Even though there's no cure and no vaccine, we have 30 million people today who are on treatment all over the world and living good lives. 30 million. New infections have dropped from the peak in 1995 by 60%, new infections. Deaths from the peak in 2004 have dropped by 70%. Remarkable progress. 5 countries today, 5 countries, all of them developing countries with a lot of challenges, indebtedness, climate impacts, and so on. These 5 countries have already met the targets that were set for 2025. They are Botswana, Eswatini, Rwanda, Tanzania, Zimbabwe. They are 5 of the countries with the highest burdens in the world, but they've already hit their targets for 2025. And there are 16 more countries close to that. So we see that it is possible to fight and end this disease. But we're still far from achieving it. 9.2 million people out there are not on treatment. They are living with HIV, but are not accessing treatment. 9.2 million. AIDS claimed a life every minute last year. 1 life every minute last year. 630,000 precious lives were lost to AIDS-related illnesses, and 1.3 million people got newly infected, most of them young people. Of these, 4,000 were getting newly infected every week, were girls and young women. 4,000 every week, 3,100 of those in Africa. New infections have the face of a young girl in Africa. 63% are young girls, are girls and young women. So this year on World AIDS Day, we've decided that the role of communities be recognized and supported. And that's why we said, let communities lead. We shine the light on the role of communities, because it is communities that have led every bit of success we have achieved. Some of it has been said already. Let's start with the battles of the 1990s and 2000s to break the power, the monopoly of pharmaceutical companies, so that medicines could be available to everybody. It was communities that led, from South Africa to Brazil to Thailand. It was communities rising all over the world and fighting for the lives of everybody. Because treatment was available here, but 10 million people who should be alive today died waiting for prices to come down. Communities fought, brought the prices down from $25,000 per person per year to today, when it is like $70 per person per year. So whether you live in Lilongwe, Malawi, or you are in London, UK, you may be getting the same treatment, only that in Lilongwe, it costs $70 for the whole year, and here it might cost $1,000, affordable here. So this is an achievement of people like yourselves, communities. It is the communities who have fought to overturn these laws that criminalize people who are at risk of HIV. When this struggle started, 2/3 of the whole world had laws that criminalized LGBTQ people. Today, it's down to 67 countries still with such horrible laws that deny people their right to life and their right to health. Only 1/3 of the countries of the world still have these obnoxious laws. Others have repealed them. Whose work was it? Communities. We are seeing countries such as India, Botswana, Angola, Antigua and Barbuda, Gabon, Barbados, Singapore, Mauritius, Cook Islands. This is a wave of decriminalization going on. My country, Uganda, went in the wrong direction. I'm sad about that. I'm ashamed of that. But it isn't the trend. The global trend is towards decriminalization, and that's the work of communities. Standing up to their governments, making the case for the right to love whoever you want, the right to be who you are, be accepted as a citizen. So there's our communities and their action. Communities have transformed global health. It is HIV that has led the biggest transformation of global health, taking treatment services from hospitals and clinics right into the communities. Communities lead service delivery in many countries. In my country, Uganda, we have 84 drop-in centers. These centers are places where gay men, trans women, sex workers, anyone who is afraid of stigma or who is criminalized can go to this safe space and get what they need, whether it's condoms or ARVs or a test, can rest, can just have a rest and run away from homophobia in the society, from violence in the society. This is a place where some people living with HIV will leave their tablets and go home because they don't want people at home to know, because they fear stigma, rejection, but they can leave their tablets there and go back and find them. These centers are so important. There are people there. They are called peer educators, young gay men, who will go into the community to find that person who can't even find their way to the center, to this drop-in center. This is life-saving. This is different from people visiting hospitals and clinics. They get what they need where they are. It's communities who've led this change. It was amazing during COVID to see how far they went to get services to people who were in lockdown. So communities save lives, so we say. And so I've talked about their campaigning, their leading of services, monitoring government-led services and demanding for better quality services for inclusion, all this work that they do. So we say today, let communities lead. Acknowledge the role of community leadership in leading the HIV response globally, resource it. 9 years ago, 30% of all HIV funding was going through communities. Do you know what it is? At the last count, 2 years ago, it had dropped 21%. This lack of resources isn't just bad for the communities, because it's bad for them. They are stretched. They cannot do this work for free, but it's bad for all of us, because all of us are affected when communities can't lead, when they are under-resourced. So we say, resource communities. Give them the power, the resources, the space to do their work. And lastly, to governments, we are saying, communities are not in the way. Communities light the way. Anti-democratic, anti-human rights, anti-women's rights forces are pushing back against the work of communities, shrinking the space, making it dangerous for them to do their jobs. We're saying to governments today, free the space, let communities lead, let them do their work and support their work. With that, I want to say to all of you, we are in London because the UK, as a government, and the UK as citizens, as organized citizens, you've been a critical leader in the global HIV response. We are here to salute what you have done. Your government has invested from day one, 25 years ago, your taxpayers' money to fighting HIV/AIDS. Today we have a big gap, $9 billion short of what the world needs to fight HIV/AIDS. But what is there? Your government contributes to it, contributes significantly. Let me inject myself a little bit in your politics. We welcome very much the return of former Prime Minister David Cameron to lead international development, foreign affairs and international development. We welcomed his statement about releasing billions towards development. This is global solidarity. We welcome, of course, the white paper on international development that has just come out. We see in it the language of global solidarity, of fighting towards the end of this disease. So with that injection, I say, let communities lead. Thank you so much.
Thank you so much for your inspiring insights, for your continued leadership, and for your commitment to supporting community voices. And thank you for that call to action. I really loved what you said. I'm paraphrasing here, but you said communities don't get in the way, but they light the way. And it's true. The next speaker is probably one of the biggest beacons of light and hope are guiding the way, especially for young people in this country. It is an absolute pleasure to introduce the powerhouse, which is Mercy Shibembe. You used your platform. I was speaking to you yesterday, and just all the work you do, the respect you have, coming out with your story to break down stigma and the walls for people in this country. When you talk, people listen, specifically young people. So can you talk to the audience a little bit about what community means for you, the power of community?
Absolutely. For me, community has made the difference in being the girl from Cardiff who felt she didn't have a voice, to having a global voice and being able to call truth to power. So I'm really happy to be here today. I was in my early high school years when I sat in a room in Cardiff and was told that I was born with HIV. Whilst I was assured that I would always have access to treatment and the care that I needed to live a long and healthy life, I was warned about one thing: that people living with HIV still faced barriers even though they might have access to treatment, simply because they are often from communities that society doesn't care about. The communities most impacted by HIV face barriers time and time again because of normalized stigma and discrimination. I happen to be a migrant, Black, and a woman, all things of which I am immensely proud of, but they are things that have been weaponized and used to devalue me and my contribution and my community. In the UK, my community still lags behind in many of the wins that we should have had from innovations such as prevention, accessible treatment, access to safe services where we can feel seen. Interventions that have been designed without us to do to us have failed us. A few years ago, I was a commissioner as part of the HIV Commission, which considered what it would take for England to become the first country to end new cases of HIV. This process included visits to communities across England, and what struck me and what I've kept with me till today is the deeply felt impact of cuts to services and support for people living with HIV. These cuts have been fueled by the idea and the myth, quite frankly, that HIV is no longer a problem in the UK. It's something that we dealt with in the 80s, allegedly. This has not only affected access to crucial services, but has amplified the societal hurdles that people living with HIV face daily. We have made some progress, having reached some of the 95, 95, 95 UNAIDS goals, which means that people are getting diagnosed, although far too late in the UK. They are getting on treatment, and their viral loads are becoming undetectable. We might have a defined national comprehensive plan that was published in 2021, however many prime ministers ago. However, our focus should be on doubling down on how we truly harness community leadership to ensure equitable access and uptake of HIV prevention programs. We need to scale up HIV testing and optimize rapid access to treatment and engage people in care so that they stay in care. And above all, we need to continue to improve the quality of life of people living with HIV. What's the point of having tools to ensure that I can live a long life if we won't use those tools to ensure I can live a fulfilled life? We'll continue to live in a country where stigma is deeply entrenched, where systemic barriers and health inequalities thwart any progress for prevention, treatment, and care, where people face a postcode lottery that determines the care they receive and the lives they can live. And in the face of this dwindling infrastructure, community leadership has never been more vital. As a young person living with HIV, I'm often told, you'll be the leader of tomorrow. But what if people understood that I could lead today? Because when communities lead, initiatives and programs become more than that. They become movements. Embracing this approach must ensure that interventions are not imposed from above, from people who lack knowledge and understanding of and cultural competence to work with communities, but people who are willing to give up their power, the seats that they've grabbed onto for so long, and say communities can take the lead. This means a transformative shift must happen that truly recognizes the strength and resource that communities already have, and we must acknowledge that the fight against the HIV epidemic is only going to be won when communities are enabled to lead.
Thank you so much for those amazing remarks, Mercy. There's a lot to think about, a lot to process with that. And we hope that world leaders and funders are taking note of everything you said. Andrew Mitchell, the UK Minister of State for Development and Africa, really wanted to be with us today, but unfortunately he had some personal obligations, which means he can't be with us. However, he has sent a message which he would like to share with us today. So over to the message, please.
Good afternoon. I would have loved to be with you in person, but I am still pleased to be able to share my thoughts on this special day. 30 years ago, a diagnosis of AIDS was a death sentence. Today, people in England diagnosed with HIV receive world-class care that enables them to lead a healthy life. That is an extraordinary transformation. Yet we must go further. And that's why we are spending nearly £23 million to end new transmissions in England by 2030. And we are already making progress. Infections have fallen by almost a third since 2019. The vast majority of those living with HIV are now on high-quality treatment with undetectable levels of the virus. But elsewhere in the world, far too many people with HIV are being left behind. For example, in sub-Saharan Africa, 4,000 young women and girls are infected every week. This is heartbreaking, and we can and must do more to halt its spread. We welcome innovations such as the dapivirine vaginal ring, developed by the International Partnership for Microbicides and funded by the UK, UNAIDS and others. However, I'm extremely concerned about the exclusion from essential health services of key populations like the LGBT plus community. The UK has been a long-term supporter of the Robert Carr Fund, which champions the rights of such marginalised communities. And we will continue to protect them, working closely with our partners in civil society. As we celebrate the launch of their annual flagship report, I thank UNAIDS for keeping us focused on the inequities driving the epidemic. And I look forward to working with all of you to champion the voice of people living with HIV and end AIDS as a public health threat by 2030. Thank you very much.
Great strong words there from Andrew Mitchell. Yes, please go ahead, Winnie.
The great message. That hasn't been meeting
Minister in waiting, that's what we're in front of. Yeah, great words by Andrew Mitchell. We really need to work with civil society to turn those words into action, and that's why we're all here today. Next, I'm going to hand over to one of the world's leading champions for community leadership in the AIDS response, Solange Baptiste. Solange, you are a passionate, brilliant, and inspiring leader with a long-time commitment to the fight for HIV treatment and social justice. And you are the current Executive Director of International Treatment Preparedness Coalition. So the floor is yours, Solange.
Thank you very much. Thank you. Is this working? Am I good?
Yep.
Thank you. Thank you so much for the invitation, and thank you for the inspiring words. I just want to add my contribution here and really think about what are some of those blocks to getting community leadership going? What are the things impeding us? So today, ahead of World AIDS Day 2024, we find ourselves at a pivotal juncture in the fight against AIDS. So we have new pandemics, we have shrinking health budgets, everyone is trying to do more with less. And we face the challenge not only to preserve, but also build upon the achievements that we've had in the last 4 decades. So I want to use this time to highlight 3 critical areas that enable us to lead. I want us to talk about data, I'd like us to focus on pricing, and I want to think about funding. Data, pricing, and funding. So if we talk about data first, at this point in the HIV response, we see a recurring pattern. Countries achieving general population targets, as Winnie's explained, we have countries, 5 achieving, 16 very close. But when you open the door and you unmask what is behind that, you start to see the inequities and leaving vulnerable and marginalized groups behind, especially young people and children. So as we look to the future, our traditional methods of understanding how are we doing, what's our overall progress in HIV, like population-based surveys, those cumbersome, long things that we have to do, they're very expensive, those things will become less effective. It is time for communities to lead in data generation. If we need reliable, timely, and granular data, community data generation efforts must be increased and sustained. Community-led monitoring produces data that is relevant and helps to craft co-created solutions. Gone are the days, guys, gone are the days when community data was undervalued, when we secretly said, oh yeah, that's from the community, so just put it on the side, and they're rubbished as not valid. Those days are gone. It is now time to ensure that scientific groups utilize community data for more effective decision-making and optimal resource allocation. So I want to turn to the second point on pricing. The healthcare sector is grappling with skyrocketing prices. We cannot continue to turn a blind eye due to fear of geopolitical backlash. People are dying because life-saving medicines can't reach them due to stark disparities driven by market manipulation and exploitative regulations. How is it that a 10-day course of remdesivir for COVID-19 is 42 times more expensive in Argentina than it is in India? Let's just think about that. These inequities demand a major strategic shift and overhaul. Let communities lead in making medicines affordable. For too long, we have been pushed out from the near elitist and specialized domain of the fancy intellectual property lawyers and the patent policy offices. Those are those people, they know those special things in a secret box. Today, communities of people living with HIV have demonstrated their ability to influence these areas significantly. They oppose bad patents, they prevent evergreening, they shape laws, and they regulate for better access to health products. Communities are partners in designing a people-first ecosystem. They're not a drain and passive recipients, but active shapers in the so-called market, definers of intellectual property laws and healthcare policies. The final area is funding. This World AIDS Day, we are highlighting, and we thank UNAIDS for highlighting the importance of community leadership. But we must confront a hard truth. Genuine community-led initiatives are currently being stifled by an unfit donor model. If these barriers are not dismantled, the promise of unlocking billions in funding, as we heard today, will just be hot air. The existing funding model patrols for risk. You know, everybody's looking, is this okay? Can we send the money? Though well-intentioned, it is a tangled bureaucracy made for form fillers and log frame lovers. You know, those ones who like to fill out the forms. And alienates the very community and impacted groups it is meant to support. We urgently call for a radical overhaul in our donor approach, one that is simpler, more transparent, and adaptable to community needs. Remove the barriers that you have set. Short-term project funding is not the way. Real change involves directing funds to where they are most needed, in the hands of community leaders. So to conclude, communities are the very heartbeat of our success in ending AIDS. Community-led action is the most effective countermeasure. And I'm using that word purposely because we've hijacked it. You know, we've hijacked it to mean pills and molecules and biomedical interventions and science. But community-led action is the most effective countermeasure in the HIV response, yet it remains underutilized and underfunded. It is time to fully invest in community leadership, removing barriers and reshaping systems. The future is not just community-led, it depends on it. Let this World AIDS Day mark a renewed commitment to community leadership. The time to act decisively is now. Thanks.
Data, pricing, funding. Well, we left you with so many remarks today. There's a lot to take in, but these are all call to actions that are so important. If we're being serious about ending AIDS, we have to be serious about communities and what community voices are saying and what we're calling for. So friends, it has been my honor to moderate this event with so many important voices. For me, this has been absolutely mind-blowing in knowing how many people and communities are out there around the world who are working through their own passion to help people who have been affected by the virus. The great thing about this report is it gives case study after case study of how communities are trying to end AIDS and why we need the support and the resources and why we need to lead. We know that today there isn't a cure and there isn't a vaccine for HIV. But we have effective prevention options such as PrEP, PEP, and DUE equals U. HIV medicines preventing HIV infection. We need everyone around the world affected or most at risk of HIV to have these options, to have availability of these options. We need to support and fund this amazing community of people around the world who are giving their lives to helping us end HIV. I call on you, the UK government, and governments around the world to help us end this pandemic, which we can end by 2030, but we need not just your words of support, we need your commitment and your funding. We know you can do it. Please continue to lead in the fight to end AIDS. I would now like to open the floor up for questions. If there's any hands up. Okay. I actually just want to stand up and meet people. Thank you. I believe there's a hand up at the back. Yes?
Hi, yes, yeah, my name's Louise, I'm living with HIV, and I've recently started a company for people living with HIV, living well, and I found it quite difficult to navigate the framework or the system of how to access, be it business support, be it social media support, be it funding, just sort of letting people know that there's something out there for people living with HIV who want to live well. And I just wasn't sure how to navigate that, you know. And I hear what you say in relation to let communities lead. And I was just sitting here thinking, I'm not sure if that pertains to me or if we're talking about different types of communities. I wasn't quite sure. Thank you so much for listening.
Can I just say something on that as well? So in one of my roles that I do, I lead a funding program to support Black children and young people in the UK. And as a funder, one of the things that I've really noticed about the UK space is we don't deliver grant funding or social investment funding to Black-led organisations well. And so any funders in the room, you really need to be getting down from your ivory towers and funding the communities who are actually living out the issues.
I think that speaks to a larger problem, though, isn't it? Funders generally like to go for the more established organisations that are great at development talk, who can write in these large funds, who know the funds exist. Every movement needs new energy, new faces, new stories. How do we help people, just like this amazing woman with her new amazing initiative, which the UK needs, I'm sure. How do we help people make sure that they can access funding and foster an environment of collaboration too?
This is some of the work we do at UNAIDS. UNAIDS, we are a small technical advocacy organization that leads, coordinates the global AIDS response. Then there are other big funders like Global Fund. We help them to raise money, and they get a lot of money that then is channeled to countries, developing countries, to fight HIV. We've got an American program called PEPFAR. That's also a lot of money coming to help countries fight HIV. Well, planning for this money means that if the money is going to work well, you need to have all interests right there and putting their stake on the table and saying what their needs are and receiving what they need to fight for their lives. So this is what we do. We bring together the stakeholders in the planning processes for this big money. In many cases, and this is some of the work I'm proudest of, we will be bringing to this meeting room in the negotiation for how these millions of dollars are going to be used. We bring into that room groups of LGBTQ people. These may be criminalized in that country. Think about it. They do not have a right to exist. They are criminalized. Their organizations are not registered because they are not accepted as legal. So, but we are able to bring them, to negotiate for them to have a space in that room and to make their demands and to be part of delivering services to themselves. This is some of the work that we are most proud of. I was recently in my country visiting, and they were in the planning process. And I sat at one, there were like more than 100 people in the room sitting on tables of 8. I sat at one table. There was a professor of epidemiology sitting at the table. There was the leader of a group of, they call it Key Population Consortium, a leader of gay groups, sex workers, people who inject drugs are all part of what was sitting at that table. there was a woman with disability living with HIV sitting at that table, and a government, a bureaucrat, a leader in the planning process was sitting there. And I listened for a few minutes to this conversation and I felt, yeah, this is what I want to see. But we're not yet where we want to be. It's true, we are able now to bring people there, but as someone said, being at the table isn't enough. Is your voice taken into real account? Are you able to monitor and see that what has been agreed is what is done in the communities? All that is part of this struggle.
Yes, please.
Yeah, I would just like to say that yes, the community is you, as my friend. It's definitely, this is you. It's not the scientific community, it's not an arbitrary community that exists out there, the funding community. It's the community of those affected by HIV, those living with HIV, their families, their loved ones, to make sure that they can live a healthy and, as Mercy said, fulfilled life, the quality of your life. And I think what I heard you asking is, how do I navigate a space where it's hard to find the information, feeling alone? And I think it's important when we think about funding, which is why this turned into a funding answer, is to fund the right networks, to fund the organizations that are truly doing the work and not the ones kind of like in the ivory towers. And I think pooled funding mechanisms like the Robert Carr Fund are good examples of funders that fund specifically networks that reach people. And I think the idea of all organizations having to be registered and formalized and fancy is something that is difficult for funders to think of. How do we get money to them? And so the way around that is through consortia, working with others and coming together, because at some point they have to manage risk and look at financial management, because governments say, well, I gave you money, how did you spend it? But at the same time, we have to balance that with reaching people who are doing the actual work. So that's the note to the donors, and the note to you is simply to say, this is you. Thanks.
We have a few online that we'll get to, and then we'll get back in the room, if that's okay. Big hello to our online audience, by the way, who has been very patient and listening in. I'll give one to you first, Mercy, and then I'll give another to you, Winnie and Solange. So this is from Sally Rogers, a UK health journalist. And question to you, Mercy. How have you managed to connect with people in the UK, and what is the reaction to HIV for a generation that has not necessarily grown up with HIV? And the question I asked to both Solange and Winnie is from Margaret, who is an independent journalist in South Africa. What more can South Africa do to support community leadership, and what is your message to the South African government? So Mercy, will we begin with you?
So I met my first ever the first time I ever met someone my age living with HIV was because of a community organization called Chiva. And to me, again, that speaks to the power of communities, because it really enabled me and other teenagers living with HIV to have a space where we can come together. In terms of the reaction that I've had, people often say, oh, like I thought HIV, like we did that, like it was a trend that we're now over or something. And so the reaction definitely has shown that we're still definitely stuck in the past when it comes to attitudes towards HIV in the UK. People still ask me if I can have children. People still ask me if they can share a cup with me. People still ask ignorant questions, and it shows that it hasn't cut through properly in the general population in the UK.
I'll share a point with you, Mercy. We did last night, we had great fun. And the question about South Africa.
You want to go first?
Okay.
Sure. So ITPC was born in Africa, in South Africa, sorry. And so we have a lot of our roots and got our definition from that space and how the HIV movement was defined. I think the message I would give to communities, South Africa has a very robust civil society. If you think it through the apartheid and you think about, the ability to go in the streets and toy and say, this is what we want, this is what we need, you will find people willing to go out and speak up and speak truth to power. It's never been shy. What I think we need to do now is match that with data and solutions. So often there's a lot of you holding the government accountable. And I think at this point, we are all trying as a global community to figure out the next step. The high-hanging fruit, as the ambassador for PEPFAR kind of calls it, says we need the high-hanging fruits, you have to do extra work. So I would say that we need to have data and we need to come together as community to say, here are the solutions, community-led innovations. Here are the things we think that should be there. And that's because the South African government needs to see community as partners, not as handouts, not as the passive recipient. And I think the other piece for the government is to make sure that they think about really clearing the space and utilizing the intellectual property and TRIPS flexibilities, local production. There's a whole lot of potential within South Africa that I feel that is completely untapped and is as a leader for the whole of the continent of Africa. I could say more, but I'll stop there. Thanks.
And I agree very much with Solange, and maybe add 2 more points. One is that where we are now in Africa is that the tools for prevention, testing, treatment are available. Not everything. Some are still out of reach, like the PrEP and so on. But what's available is life-saving for prevention, treatment. But those who don't have access because of inequalities that deny them that access. Inequalities in rights, in access, say, to education for girls and so on. So to me, to remove those barriers, those inequalities, we need to do more movement building. We need more power to challenge those who hold power to deliver on equality. And that must mean that the HIV movement must hold hands with other movements, with the human rights movement, with the women's rights movement, with labor movement, so we need more connection of movements to fight, to remove the inequalities that are denying people access to what is there. That's one. The second, that point I'd like to add about Africa is that this backlash we are seeing, this backlash on human rights, it's an anti-human rights, anti-women's rights, anti-democracy backlash. That this, we must understand it from the global context that we are in, that Africa once again is the battleground for a war, a strategic war between the East and the West, basically. That we need to understand that and we need to organize ourselves to say no to this backlash, say our issues are our issues. We don't want to be the hot spot where the wars over strategic issues and resources are fought. We need to be political here. We are being crushed because there are, bigger forces fighting for what is in our territory. That is so dangerous for our health, for our lives, for our education, for our kids, for everything.
Okay, we'll take to the floor. If you could just say your name, your organization, and your question, and who you'd like to answer. Please, the guy at the back.
Hello, I'm Jameson from UNAIDS for Global Mental Health, and we're very proud to call StopAIDS great friends of ours and follow their lead in championing the care of the whole person, which includes their immediate physical HIV needs, but also including their mental health and well-being, and friends of UNAIDS as well for their technical lead on integrating mental health into HIV responses. Mental health is much like the HIV community, and it's highly stigmatized. And lots of nice words are said about mental health now. Action is less forthcoming. But we know that by integrating mental health into how we respond to HIV, to a person's needs, not only do we improve their mental health, we massively improve their physical health as well. But that message isn't getting through into action. And so I wonder from the panel, if you were speaking to somebody in power, how would you convince them that they should be looking after someone's mental health alongside their HIV needs?
Very good question. The world woke up to mental health, particularly during COVID. We who lead institutions, we suddenly saw it right there, with our own staff failing to cope just by being locked out and not going to work with others. So we started to, my organization, we started to invest more in mental health during COVID. Those lessons, I feel, are not being taken forward. But we really woke up to the issue of the mental health of people. Now, how do we convince those who deliver health to make the mental health as important as the rest of as physical health and other? You know, we need to be humble here. We need to understand that in other health traditions, mental health, physical health, spiritual health, we're all one, are all treated as one. If I go to my aunt who is a natural doctor back home, and I say, I am not feeling well, I'm not sleeping well, she will make me first pray, and then she'll give me a treatment, because they are connected. So I think we need to learn from other health systems, the Eastern health system. They also connect better mental health with physical health, if you are from the East. It is very much this Western model that has separated mental health, spiritual well-being from physical well-being. We need to learn, we need to integrate, we need to take the best that we find in other health systems and bring into our own. I think the big issue is the way health has been constructed here in the West. This is the real issue.
We only have a few minutes left, so I'm going to ask this gentleman if he'd like to ask his question. But while he does that, I'm going to just give one from online too. The Voice of America. Funds for HIV are declining. Reauthorization of PEPFAR is stalled for the first time. How are you going to raise the funds needed for HIV and communities? It's the $1 million question, isn't it?
Look, I think it's important for us to not think about the issue and the challenges of HIV funding outside the wider global crisis we're having for financing health and for financing all the issues that we're currently facing, climate, all of it. There are several schools of thought on how we can try to do that, but I think my experience and what I've been reading is it's not that there isn't money. We don't need more money. We need to use the money that we have better. Because it's kind of like this whole argument of, do we just need to now squeeze out? We have no other sources of funding. How do we find this money? But it's the money that we have. We're not necessarily putting it in the right interventions, and we're not using it the best way that we can. I think the other part that we have to think about is what has been echoed in Mia Mottley, in President Ruto, and President Ramaphosa. All of their comments echo this idea that lower income countries are not a drain. And when you look at the World Bank and the loans that need to be taken out, and the taxes and the debt crisis that's happening, these lower income countries are not the ones that are draining the system. They need to be seen, just like the argument I'm making for communities, as partners. And there's the whole concept of global public investment, where all contribute, all benefit, and all decide, can come in as a pathway to democratizing our funding. So this whole begging bowl, please give me, I'm a poor country, that whole kind of donor recipient paradigm has to break. And we need to see this as a whole community, global community, to address our financing challenges. And that's what I think.
I agree with you. Let's put some facts on the table. Last week, there was a vote at the United Nations General Assembly. More than 125 countries voted that they want a global corporate tax reform. and a handful, 40-something countries, I'm not going to name them, but mostly rich countries, said no, they want things to stay as they are. Why? Because they are benefiting from a corporate tax system that's full of loopholes, that's archaic, that was built long ago when business was in the borders of countries and not across countries, and that now they're able to use that loophole system to make a lot of money in many developing countries while not paying their fair share of taxes. So that's where we start, that the lack of resources in many developing countries is a result of extraction from them, but no return. The taxes aren't paid. That's one. Come to borrowing. The poorest countries go to borrow on the global financial markets at a higher, much higher interest rate than the richer countries. There's an injustice in the global financial system. Secretary General has called for a reform of the international financial architecture to make it fairer so that a poor country can borrow at the same rate as a rich country. It's not so. Today, a country like Zambia, 70% of its revenue goes towards just paying the interest on its debt. That's 10 times what it spends on health. It has asked for debt restructuring. It took 2 years to get an amount of restructuring that wasn't significant. It's still highly indebted. So there are issues in the global economy, from taxation to the rules on borrowing, financial architecture, to the rules on intellectual property, that you can hoard a life-saving treatment like COVID and people die and you just maximize and make more billions. There are those injustices in the global economy that need to be fixed too. But for our disease, this one, we fight HIV. We talk about global solidarity. We look for solutions to overcome these barriers, even if we don't remove them in the global economy and we don't change it suddenly, but at least we get countries to work towards solutions to the financing issue. Today, there's a gap of 9 billion in the global AIDS, 8 billion in the global AIDS response. What is 8 billion? I was just looking and seeing that the European Union, since this war in Ukraine started, have spent more than 25 billion in 2 years funding that war. 8 billion. The United States has put in more than 75 billion in that one war. 8 billion for the whole world to keep moving towards ending AIDS. So it's not that the money isn't there, it's the priority. The priority. I said that.
Unfortunately, we're out of time. Only the powers that be told me we had one more question, and it's online from a very persistent person. We'd love to hear from. But don't fret, if you have questions that can't be asked, come to us and we'll have them answered for you. And for those people online, please get in touch and we will get those questions answered for you as well. So don't your questions won't go unanswered. And if people want to do one-on-one interviews with the amazing panelists, come forward and we'll try and set that up too. So the last question is to someone called Sean Dern, who's the producer, host of Queer Legends, an oral history podcast, who is online. So Sean, can you ask your question? Is that allowed?
Hi there, and good morning from Montreal, Canada. The question I did have is the ending AIDS by 2030. The medications are there, the technology exists to make that happen, but that's only 6 years from now. So, and given all of the challenges and the obstacles we've heard people mentioning this morning, is this something that we think is actually doable?
Wow. Mercy, would you like to?
It's doable, but people lack the will to do it. So the question I asked earlier was, what's the point of having the tools to give people living with HIV a long life, but not using those tools to make sure they can live a fulfilled life? And we're just not doing it, and it's not good enough. It's poor. It's shoddy leadership.
if I could do, oh, sorry, go ahead.
It's the political will. We know how to get there to the finish line. We know some countries are actually on their way to that finish line. It's possible, but it is a lack of political will to do the things that need to be done. Put in the funding, remove legislation that prevents people from getting what they need, create an enabling policy environment, let communities lead and do their job. These are the things that will make a difference, and give access to the new technologies that can transform the response, like the long-acting injectables and so on, equal access for everybody. These are the things that need to happen. They are not that expensive compared to some of the investments in wars and all of that. We can save lives. And I want to use the opportunity to thank very much Secretary Andrew Mitchell for his commitment, because we see that even in this difficult situation, fighting to keep the resources in this response and in the things that save lives, like girls' education. We want to say to the activists here that you speak for your people, but you also speak for people in the developing countries. That's the solidarity. So thank you all, and thank you for this opportunity to do this with you.
Well, Solange, the last word is for you of this very amazing panel. How do we end AIDS? How do we get the political will?
Oh dear. I always get the easy question. I think where I would like to land is on the title of this, Let Communities Lead. When I first saw it, I was like, why are you letting us lead? We're leading already. What are you doing? What does this mean? And I think it really opens up a conversation about the leadership and the capacity that already exists. A lot of the times we are talking about capacity building and skills building and helping communities to reach their potential. It already exists. The expertise exists, the know-how exists, the leadership already exists. What we need to sort out is the blocks and the impediments that we have on the way to prevent them from leading. So I will just stop there and say, let communities lead.
What a way to end on. Wow. Thank you so much to Winnie, to Mercy, and Solange. It's been an absolute amazing event. Okay, everyone, you're not leaving empty-handed. We have lots of beautiful t-shirts at the back. Wear them with pride. And we're going to take a group photo. So please help yourselves, chat amongst yourselves, and yeah, we'll mingle shortly. So thank you very much again. It's been an absolute pleasure. Great.
Thank you, Robbie.
No,
Thank you.
thank you.
Well done.